All right, let's jump right into this explainer, where we're unpacking a World Economic Forum report that completely flips how we look at the global healthcare economy. For decades, we've treated healthcare like this unavoidable massive expense, right? Just a constant drain on public and private wallets. But what if we've had it completely backwards this whole time? What if healthcare isn't a sunk cost at all, but literally the single most lucrative investment humanity can make? Today, we're exploring a massive pivot in how we approach human well-being. And I gotta tell you, the financial data backing this up is absolutely staggering.
Multi-trillion dollars. And no, that's not a typo, and it's not an exaggeration. The WEF data shows that shifting our approach to health could actually unlock multi-trillion dollar global economic gains by the year 2040. Just imagine adding the GDP of several major countries combined right into the global economy, all just by changing our big picture health strategy. It's an astronomical figure. It's the kind of number that forces policymakers, business leaders, and, well, all of us to sit up and really pay attention. We're not just talking about saving a few bucks on hospital admin fees here. We're looking at an unprecedented engine for global wealth creation that's literally sitting right in front of us, completely untapped.
So, seeing a massive projection like that naturally brings up the million, or I guess trillion-dollar question. How exactly do we unlock this massive economic potential? How do we take healthcare from being seen as this unavoidable global drain and turn it into the ultimate high-yield investment? It kind of sounds like a magic trick, doesn't it? But here's the thing. The secret isn't some miraculous, super expensive futuristic technology or a sci-fi wonder drug. Actually, it just requires a fundamental shift in our collective mindset and a total restructuring of where we put our resources.
Section 1. The cost of being reactive. Healthcare as a sunk cost.
To understand the solution, we've first got to look at the heavy economic burden of what we're currently doing. Our current system is incredibly reactive. We literally wait for sickness to strike before we lift a finger. We pour unbelievable amounts of money into late-stage interventions, which come with staggering financial costs and massive lost productivity because, well, people are simply too sick to work, and that severely drags down global GDP. But on the flip side, preventative care acts early. It comes with a surprisingly low financial cost up front and acts as a massive economic driver over time. Right now, we're basically stuck paying top dollar to put out raging fires instead of just installing cheap smoke detectors.
Section 2. The WEF's Low-Cost Preventative Playbook, Reframing Healthcare from Treatment to Prevention.
Now, this forces us to update our own vocabulary and fundamentally redefine the word healthcare itself. For most of us, healthcare means a trip to the hospital when you're already sick, right? Or grabbing a prescription when you have a terrible cough. But true healthcare is the active, low-cost, and continuous process of maintaining wellness to prevent disease, rather than just treating late-stage illness. It's all about consistent maintenance, not emergency repair. Think about how you treat your car. You get regular oil changes so the engine doesn't blow up, right? We need to apply that exact same proactive logic to human biology, but on a global scale.
So, what does this actually look like in practice? Well, the WEF playbook starts with early disease screenings, catching issues when they're cheap and easy to manage. And that pairs directly with nutritional and lifestyle interventions, because our daily habits really are our first line of defense. Also, since we spend a huge chunk of our lives at work, workplace wellness programs are absolutely critical here. Top the whole shebang off with proactive public health education and improved access to primary care, and you've got a system built on true affordability. And notice, none of these are multi-billion-dollar sci-fi inventions. They're just simple, proven actions that communities and policymakers can easily implement right now.
Section 3. The 2040 Economic Boom. Realizing multi-trillion-dollar return.
Okay, let's look at the data, because our choices today literally dictate our economic reality by 2040. If we stick to the status quo, our current reactive trajectory, our economic momentum is severely stunted. The compounding costs of disease just drag us down. But if we pivot to a preventative health trajectory, global growth shoots way up, unlocking extraordinary multi-trillion-dollar gains globally. It's this incredible compounding effect where a single dollar saved on emergency care today actually becomes capital invested in global innovation and growth tomorrow. So where exactly is this economic boom coming from? Breaking it down. First, we get increased workforce productivity. When people are healthy, they work better, they innovate more, and absenteeism just plummets. Second, we see drastically reduced treatment costs. That means we're no longer bankrupting hospital systems and insurance pools with really complex late-stage disease management. But honestly, most excitingly, we gain extended healthy lifespans. People aren't just living longer on a calendar. They're staying active, contributing members of society for much, much longer. And together, all of these things create this amazing virtuous cycle of economic prosperity. Section 4. You're a stake in the shift.
bridging the macroeconomic to the micro.
Now, it's pretty easy to look at a World Economic Forum macroeconomic projection and think, well, that's just a topic for prime ministers and CEOs. But this global shift actually starts locally, with you and me. It begins when we adopt personal preventive health habits, sleeping well, eating right, staying active. Those are literally micro-investments in the global economy. From there, we can advocate for proactive workplace wellness. If you're an employee, ask for these programs. And if you're an employer, putting them in place is objectively good for your bottom line. Ultimately, this builds all the way up to supporting low-cost public health policies in your community. That multi-trillion-dollar future is driven entirely by our daily habits and the policies we champion.
The absolute core takeaway from the WEF report is undeniable. Low-cost preventative health measures offer multi-trillion-dollar economic gains by 2040. Proactive health is no longer just a medical imperative, right? It is our greatest untapped economic asset. We absolutely have to stop viewing health as a separate silo from the economy. They're deeply, inextricably intertwined. A healthy population is quite simply a wealthy population. By spending pennies on prevention today, we're quite literally minting trillions for our shared future.
So I'm going to leave you with this final thought to ponder. If the data definitively proves the massive, multi-trillion-dollar returns of staying healthy, why are we still waiting until we're sick to invest in it? Why on earth would we continue to pay for an incredibly expensive cure when we can so easily afford the prevention today? It really is time to rethink our priorities, both personally and globally, and start treating our health like the ultimate investment that it truly is.